The Centers for Medicare and Medicaid Services, CMS, quietly implemented an efficiency adjustment in the 2026 Medicare Physician Fee Schedule, cutting work RVUs for most non-time-based services by 2.5%. At first glance, it sounds small, but across an entire year of claims, this change can significantly affect revenue. The adjustment targets work with relative value units, or RVUs, which represent the time, effort, skill, and intensity physicians invest in delivering a service. Under the 2026 rule, CMS reduced work RVUs for most services that are not strictly time-based. The reasoning from CMS is straightforward. They believe many services have become more efficient over time due to improved workflows, electronic health records, and standardized clinical processes. The reduction primarily affects procedure-based and evaluation services that do not rely on time-based valuation. Examples include many diagnostic procedures, certain surgical services, several specialty consultations, some evaluation and management services tied to complexity rather than time. In contrast, services that are explicitly time-driven, where reimbursement directly reflects time spent, are largely less impacted by the adjustment. The policy is part of CMS's broader effort to control Medicare spending while encouraging operational efficiency across healthcare systems. CMS has been gradually shifting payment models toward value-based care, quality performance metrics, efficiency-driven reimbursement. The 2.5% adjustment reflects the agency's belief that healthcare technology and workflow improvements should translate into lower service costs over time. For many practices, the biggest issue isn't just the 2.5% cut itself. It's the cumulative effect of multiple Medicare payment changes happening simultaneously. Practices are already dealing with rising staffing costs, increasing payer compliance requirements, higher claim denial rates, expanding documentation workloads. When reimbursement shrinks even slightly, profit margins tighten immediately. While practices cannot change the CMS rule itself, they can adapt strategically. Several actions are already becoming common across the industry. 1. Strengthening revenue cycle management. 2. Optimizing coding and documentation. 3. Expanding time-based services where appropriate. 4. Leveraging operational automation. The 2.5% efficiency adjustment in the 2026 Medicare Physician Fee Schedule may look minor on paper, but its real impact depends on how prepared a practice is to respond. Healthcare reimbursement is evolving rapidly, and policies like this signal a clear trend. Efficiency, accuracy, and financial strategy are becoming just as important as clinical care. Drop a comment right now. Has your practice already felt this cut, or are you just hearing about it today? And if this was useful, subscribe to our channel for more such updates. See you in the next one.